Hi everybody, today we're going to talk about glaucoma. You've probably heard of glaucoma but not sure what it is. Glaucoma is a group of eye diseases that damage the optic nerve and cause vision loss. It is one of the leading causes of blindness in people over 60. There are no early signs and the damage that occurs is irreversible, so it's very important to catch it early. Causes are typically due to high pressure in the eye, which puts pressure on the optic nerve and causes the vision loss. There's also some systemic conditions that we'll talk about that can also cause damage to the optic nerve and increase your risk for glaucoma. So risks for developing glaucoma, first of all, are high intraocular pressure, which we measure at every eye exam. You're people over 60, if you're African American, Asian, or Hispanic, you have a much higher risk for developing glaucoma. If you have a family history, you're also a higher risk. If you have certain systemic diseases such as diabetes, high blood pressure, heart disease, sickle cell, anemia, you are a higher risk. If you have thin corneas, which is the very front part of the eye, if they're very thin, you're also higher risk. If you have very high nearsightedness or farsightedness, if you've had past injuries to the eye, you're also increasing your risk for a certain type of glaucoma. And if you regularly take steroids, either in pills or inhaled form, those steroids can cause an increase in pressure and then cause glaucoma. The way you can prevent it, first of all, is diagnosing it early. So the way to prevent the vision loss is to have your eyes examined regularly. And if you have a family history, to know about it, because you're at higher risk and you should be checked more often if you have a family history. If you're engaged in certain sports where you could have an eye injury, wear protective eyewear. And if you end up having glaucoma and you're prescribed drops to treat it, take the drops regularly, because they are very effective at slowing or even halting the progression of the disease. But again, there's no reversing the damage, so you have to catch it before it gets advanced. So here at the Vision Center, every eye exam, we always screen for glaucoma. So unless someone has looked into your eyes and told you that you don't have glaucoma, it's always possible that you have it. So we highly recommend annual eye exams at least every couple of years for those people that aren't at high risk. And if you want to set up an appointment, please call us or request an appointment on our website.